Good morning. My name is Patrick Casey, and I'm representing York Region Corporate Communications. Thank you all for attending this morning. Thank you all for attending on short notice. Appreciate the attendance at today's information session as we talk about the novel coronavirus. There still continues to be a lot of information and a lot of misinformation, unfortunately, about the virus, and we want to take today's opportunity to hear from Mayor Dave Barrow from the City of Richmond Hill and Dr. Kareem Koji, York Region's Medical Officer of Health. And both of those gentlemen will be able to share some information as it relates to coronavirus and provide our media partners the opportunity to hear from us and to share this information through your media channels. So first of all, we'll have His Worship, Dave Barrow, say a few words, and then we'll hear from Dr. Koji. We'll have opportunities for questions at the end, and we also have translators here from York Region who can conduct one-on-one interviews afterwards if there's interest in Mandarin, Cantonese, and Farsi. Mayor?
Good morning, everyone. It's a pleasure to be here with you, and I want to thank Patrick, and you'll soon hear from Dr. Koji, participating in this information session of the coronavirus. And I'm pleased that York Region has joined us today in the city of Richmond Hill, so our residents and many others around here in the area can have direct information from the Public Health Minister. York Region has been working closely with the local municipalities to provide regular updates in all of our communities to clear up a lot of rumors and some misinformation. And as you're about to hear from Dr. Koji, the risk of acquiring virus in the community remains low for York Region residents. Public Health is working closely with the Ontario Ministry of Health and our hospitals and our community partners prevent transmission of the virus. This means our communities are safe, including public spaces, local businesses, restaurants, and recreation areas. And now let us hear from Dr. Koji.
Thank you, Mayor Barrow, and thank you, Patrick. I'm Dr. Kareem Koji, York Region's Medical Officer of Health. And first of all, I will start out by giving a few remarks, and then I'm very happy to answer any questions that you may have. So, we in the public health system work as a system. So the system consists of many different areas. You have the World Health Organization, you have the Public Health Agency of Canada, you have the Provincial Ministry of Health, you have Public Health Ontario, and then you have the local public health units. In addition to the public health system, we also liaise with the healthcare system. So we have the emergency departments at the hospitals, we have the infectious disease specialists, and we have the primary care physicians in the community. And there are other partners as well. So I'd like to take you through what it is that the local public health agency, like ours, York Region Public Health, does. When we get an individual who may have been to, say, Hubei and believes that they've acquired symptoms within the last 14 days, they usually, and this has been our experience so far, they usually self-identify. They may identify themselves either to the healthcare system, meaning they would call their primary care provider, or they might present at an emergency department, and we usually advocate that they call before they're present there, so that appropriate precautions can be taken to prevent the transmission of the disease to others in case they have the disease. Then they are usually assessed at, say, the emergency department of a local hospital, and samples may be taken for testing after consultation with a Public Health Ontario lab. We are usually notified as well. Now, there are some individuals who come through us first, and if they come through us, we take a detailed history And we facilitate the testing to be done through the labs and through an emergency department. Once that individual has entered the system, we conduct very detailed interviews with the individual. Our interviews are meant to identify close contacts. Now, what do we mean by close contacts? These are individuals who are usually household contacts, individuals who may have spent a lot of time, may have spent a lot of time with the individual, with the client, may have been providing care, may have been bathing the individual, may have been feeding the individual, or maybe some other sort of close care. And we then follow up on these contacts to check whether they have any symptoms or whether they are asymptomatic. Now, there are different pathways through which each of these individuals goes. There have been some changes to the protocols because, as I said, we work as a system. So as more and more information becomes available, Public Health Agency of Canada informs the local health units through the provinces as to how these cases are to be managed. Now, these individuals we refer to as persons under investigation. They don't necessarily have the coronavirus, but we suspect they might have it. So they are put into self-isolation at home. What does self-isolation mean? It really means that the individual should not be sharing a bed with any other member of the family, should not be sharing the washroom with anyone else, shouldn't be sharing utensils, and should essentially be keeping themselves to themselves. If they do need to interact with anyone else in the household, they should be wearing a mask and keeping approximately 2 meters away from that individual. At the moment, the guidance has changed somewhat in that anyone who has come from Hubei province, even if they don't have any symptoms, they are expected to go into self-isolation along the lines that I have mentioned. So they're not supposed to go to schools, they're not supposed to go to work, they're not supposed to go out shopping, etc. Right? The guidance has also changed a little bit in that anyone who has visited from China, mainland China, any visitors, we are asking them to self-monitor for the symptoms and signs. They don't have the same restrictions as have been imposed on the individuals who are under self-isolation. Now, public health questions each one of these contexts thoroughly and each one of these persons under investigations thoroughly. What we do then is we call them every day. We provide thermometers if they need thermometers, and we check on their status whilst we await the results from the labs. Virtually all the time, the results have come back negative. When the results come back negative, they're usually cleared to go. The only change now would be that if they had asymptomatic contacts, then these contacts would need to have spent 14 days in isolation before, if they've come from Hubei, before they are free to go. So that's the general overall way in which we follow up individuals. York Region generally has approximately a third of the individuals under investigation across the province at any given time. Today, for example, we had 30, and we've had lab results which have cleared a number, and we're now got we had 31, and we're now at 24, and we're expecting a number of these to be cleared by the end of the day. So that is the normal practice of what goes on. Now let me just move over a little bit to explain to you how the coronavirus is actually transmitted. Coronavirus is, we believe, is being transmitted through droplets. So that means when a person who is affected with coronavirus, who is infectious as a result of having the coronavirus, coughs or sneezes, they would throw out these droplets onto the surroundings around them. And if somebody comes along and unwittingly touches those surfaces and then touch their mouth, their nose, or their eyes, these are the areas that have the mucous membranes, the virus may be able to get in through there and get into the lungs. So that's how the transmission occurs. So what do we have to do? We have to try and break that chain of transmission. All of us have a responsibility to break those chains of transmissions. So the way that we do that is don't touch your mouth, nose, or eyes with unwashed hands. And make sure that we're washing our hands frequently. With soap and water will suffice, but if you don't have that, then an alcohol-based sanitizer. We know that the coronavirus is killed with alcohol 70% or above. So by doing that, we will be preventing the onward transmission of the coronavirus. In addition to that, there are some commonsensical ways. The commonsensical ways are basically try to avoid being too close to somebody who may be coughing and sneezing, right? Keep at least 2 meters away from them, because generally that's the sort of distance that is recommended. Also, if you yourself are sick, please stay home, don't go to work or to school. So you're trying to break any of these possibilities of the virus being transmitted. And periodically disinfect the surfaces. Normal household cleaners would suffice. So by doing all that, we will be keeping our community as safe as we can. In addition to that, and this is very important, for those of us who may be hosts to guests from China, please make sure that they're following the guidelines that have been put forward. Our website details these particular guidelines, york.ca/coronavirus. It's very important that anyone who's come from Hubei within the last 14 days, even if they don't have any symptoms, self-isolate for 14 days. And it is very important that anyone who's come from mainland China continue to monitor themselves. They don't need to go into self-isolation, but they need to monitor themselves for the symptoms. And the main symptoms that we're looking for are fever or cough or shortness of breath. Those are the 3 main ones that we're looking for. There are other symptoms that some people have suffered from. However, if there is any doubt, get in touch with the healthcare provider and call before you go to your healthcare provider. Going to a healthcare provider, make sure you don't take public transit, go in a private vehicle, keep the window down so you've got enough ventilation, put on a mask if you have a mask, and be in touch with the healthcare provider. You might want to stay in the car until they're ready to receive you, right? So those are some of the processes that we have to follow to ensure that we keep our community safe. Now, there is a lot that's happening in China. China, of course, is a different situation from what we see here in York Region. In York Region, we don't have any cases of the coronavirus in the community. Not a single case. So we don't have the virus circulating. And as I said, at any given day, we are investigating around 20 such individuals, right, who we suspect might have the virus. But to date, we haven't found a single one who carries the virus. So the community is safe. There is no virus circulating in the community. And we know that you cannot get this virus from casual contact. So going to the malls, going to a restaurant, going to the movie theaters, you're not going to get it just like that. You need to have close and prolonged contact in order to get it. And if each one of us is following those precautions that I outlined, we should be able to keep the community safe. These are the basic methods that we use in terms of controlling any outbreaks. The other reassuring piece of news is that, there are groups that constantly do modeling, and there's one group at the London School of Hygiene and Tropical Medicine in London who believes that the outbreak in Wuhan is likely to peak in mid to late February. So that's good news, and we hope that that happens. Unfortunately, in China, there are many other provinces that already have over 1,000 individuals. About 3/4 of the 40,000 individuals that have been identified are in Hubei province, but another 10,000 are in the other provinces. So you won't see the end of the outbreak very quickly, but the moment the epicenter starts going down, hopefully you will start seeing similar things happening in some of the other places. So that's the good piece of news. Now, there's a lot that has been said about screening at the airports. Most of the studies seem to indicate, and again there are some modeling studies, seem to indicate that exit screening may help to some degree. Like there is one particular model that has been published again through the London School of Hygiene and Tropical Medicine that talk about if you had 100 individuals who were infected, then about 46 of them would be picked up through exit screening. 8 of them would be infected and might get picked up in the entry screening, but the remainder would not get picked up. So that's the reality, is that travel screening doesn't seem to help very much according to the scientific literature. However, there's still ongoing debates going on about that. For us, the most important thing is really to follow those guidelines that I indicated, and also for any host families to please guide your guests so that they are following the rules that have been enunciated in Canada. Every country may have slightly different rules, but if we follow these particular rules, we should be able to have the whole situation controlled. Thank you. At this point, I think I will pause, and I'm quite open to take any questions that you may have.
Yes, if the outbreak happens in York Region, does the government or public health department has any money and contingency plan for the outbreak happens in York Region?
Thank you for that question. So the way that our public health system is organized is York Region Public Health receives its funding largely from the ministry, but also from the local taxpayer through the regional municipality of York. And every year, there's a budgetary presentation before council. And indeed, more recently, we have been challenged with budgetary challenges, as most sectors have, but we are very confident that we have all the resources we need to be able to deal with this particular situation. And should we require additional resources, which I don't think we are anywhere near at this point, I'm sure that our Board of Health, which is Regional Council of the Municipality of York, would look upon that favorably, and so might others in the healthcare system. Thanks.
Hi, Deborah Kelly with Newmarket Today.
Sure.
You mentioned there's 30 people under investigation currently. So how does that compare to previous weeks? Is that number going up or down?
So one of the things that happens in these outbreaks is that case definitions have to change. For the longest time, it was only somebody who had traveled to Hubei, right? Plus had fever and cough, right? Fever or cough or breathing problems. Now, the case definition has changed. It's just changed over the weekend. It's changed to include anyone who's traveled to mainland China, plus has got fever or cough or shortness of breath. In addition to that, within the healthcare system, we have many clinicians who may have a higher index of suspicion of someone who doesn't exactly fit the case definition, but they feel that they need to have the test done. And the public health lab has generally taken the approach that they wouldn't deny these tests. So at any given time, you would actually have more than the people that we would consider to be at the highest risk. Now, let me tell you as well that we have been awful at predicting who's actually got the coronavirus, because the reality is that there have been a number of individuals who we would have considered to be high risk of testing positive, but they all tested negative. So that gives us a level of comfort that maybe, I don't know what the reasons are, this is a novel virus, maybe those Canadians who may be going over there, right, may be taking appropriate precautions, right? Or maybe the viruses to which they may have been exposed to haven't been as virulent as, or the strains may not have been as virulent. It's very difficult to say because there have been situations where I would have been very sure that they would test positive, but that's not been the case. Thank you.
So just to clarify, so has the number gone up a bit because the definition has broadened?
Yes, so the number has gone up because the definition has broadened and because clinicians are also testing more people than they should have been testing. So in out of the 24 or so that we may be following right now, maybe about a couple or so might be at higher risk than any of the others, right, for coming back as being positive. And I expect those numbers will go down dramatically because what is happening now is the lab in Ontario, following the London instance, have not actually been releasing the negative results to us promptly until they actually get the confirmation from the National Microbiology Lab that that result is negative. So now you have a new category on the provincial list which says presumed negative. So if you add the presumed negative, which today is I think 81, and with the number that is under investigation, which is 8, right? It gives us comfort to know that out of those 90 cases, the 24 are ours, but it gives us comfort that the vast majority are going to be negative, right? So it's very reassuring. Okay.
You gave us a lot of instances this morning about what people should do if they suspect they have come down with this virus.
Yes.
There been some things that people definitely should not do in this instance if they think they're sick with this, and things that people have done in this area, presenting themselves to you or to healthcare?
So the remarkable thing is that people have been very conscientious. They have been very diligent. Virtually all of the individuals that we're encountering have self-isolated on their own accord. Now, that is remarkable, and I really have to compliment all these individuals, right? They have put forward their social responsibility to society, and they have kept their children away from schools, etc., where children are involved, and they have contacted the health system appropriately or contacted us appropriately and been channeled for appropriate testing. So at this point in time, they have really behaved very responsibly. Let me give you examples of how they behaved responsibly. They have usually put on masks because that might actually avoid other people from getting infected. They've used private vehicles in order to go from the airport to home, right? And then they've basically self-isolated themselves. So they haven't had any visitors, they haven't mingled anywhere, which makes our life a lot easier, right? Because our purpose really is to put a ring around these individuals and their contacts, the ill contacts in particular. But now we're also following the well contacts, making sure that they don't develop the disease if they happen to have come from Hubei. But as the outbreak unfolds, we can no longer rely on just Hubei as being a source. As you've seen from reports, I think in France, there was an individual there were 5 individuals from Britain who caught the virus as a result of somebody from Singapore. So these are not China, not travel from Hubei province. So you'll see more and more of this happening as the outbreak unfolds.
In Hong Kong, I think someone got infected through a family hot pot dinner. The government now, Hong Kong government advised that people don't go to any paper places, and some public place advised to be closed. But out of 20-something cases being monitored, everyone is not from China or local. I mean, they didn't go to China and they just stay in Canada and being monitored by your department right now. Or all of them cases are people from China.
So far, well, thank you for your question. The first point that I think I have to emphasize is that the situation in some other countries may be different, right? So for example, the situation in Wuhan, in the Hubei province may be very different. We don't know whether community transmission is occurring, right? We don't know whether there are a lot of people in the community, and I suspect that's the case, right? We in Canada, we in York region have no cases, right? So we don't have the disease circulating. So what's the point of not going to the mall? What's the point of not going anywhere, right? Because we don't have that circulating. If we did have it circulating, right, like we do as in China, we may have to take additional measures, right? However, that's definitely not the case. And I can tell you as someone who was at the ministry during SARS, right? During SARS, we had suspected that there was community transmission at some point, and we were on the watch out for that. But that never really happened. It was always confined to the hospitals and the household contacts. We could always trace it, apart from the SARS-2, which arose without us being able to trace where that started, right, at that time. So my point is that at this point in time, we can trace where the source is. And all the cases that have happened in Canada so far have been traced to China, right? So I would say there is no need for us to be concerned. There's no need for us to alter the way that we go about doing our business, right, in the community. It is safe. The one thing that I would emphasize is still continue following those precautions that I have said. Those are good habits. Those are good things that will stop the transmission of viruses like the flu virus, the common cold. And we do get a number of people dying from the flu virus, approximately 13 people in York Region, every year. Although the figures, if you were to extrapolate these figures from other sources, they would be much greater. It would be over 100 individuals. So, very important to bear in mind that whilst the novel coronavirus can be potentially a very serious disease, and we mustn't be complacent about it, but at the same time, we should bear in mind that there is no risk to the community just now, right? Thanks.
My second question is that out of the 20-something cases you're monitoring right now, all of them are from China, or anyone that's didn't go to China and just stay in Canada to get something that's...
So there are some cases that have come from Hong Kong, if you consider that not being mainland China, right? And but otherwise, the majority, all the other cases have come from China. But right now, several of them have just visited mainland China, and they haven't necessarily visited Hubei province. There's a very small minority that has visited Hubei province, and that's because the case definition is changing, right? And so they're getting captured, which is not a bad thing, because we want to make sure that we don't miss anyone, right? But at the same time, it does increase the workload for us, and therefore we constantly prioritize, right? We constantly do our risk assessments, and we ensure that those that are at highest risk, we've talked to the labs, we've got their tests prioritized, right? So that, we want to know whether they're positive or not. If they're positive, then we need to move a little further with their contacts, right? Thanks.
So despite your reassuring words today, do you get a sense that there is still a very high level of concern, or can I use the word panic, in some communities?
So I would say I really don't have a level of, high level of concern for the community at this point in time. At this point in time, community meaning York Region community.
Yeah, but does the community still feel a high level of concern?
Yes, yes. The community does, and maybe some of it may be based on information they may be reading elsewhere. And again, I want to delineate between the different scenarios. China is experiencing something very different from what we are. So I guess if I had relatives in China, I would be very concerned, thinking that that's the situation that's going to befall us, right? But our situation here is very different. Now, let me also emphasize that when SARS hit us, we were not adequately prepared with respect to infection control practices. We have come a long, long way with regard to infection control practices in the hospitals, in the healthcare arena, and even in broader society as a whole. You will notice that many of our washrooms now, you go in and you don't even have to touch the taps, so you don't have to touch anything, right? Whereas in the days before SARS, we used to touch everything. Even some of the designs that you see entering the washroom, say at the airports, you notice that you don't even have to push any door open, right? All these were done with infection control in mind, right? So we have come a long way to breaking the chains of transmission for the diseases since SARS. In addition to that, before SARS, we never had the Public Health Agency, Public Health Ontario. We've now got experts there. We have had a lot more investments in public health since SARS. And the public health system is very critical to assisting in the prevention of these outbreaks, right? So we are well prepared. And of course, most importantly, we didn't even know what SARS was being caused by initially, because the coronavirus wasn't identified for several weeks later. And we never had a test for coronavirus in SARS at that time. Today, the genome was identified within 2 weeks, and the tests have already appeared. And the public health lab in Ontario is assuring us that they'll be able to turn around the negatives very quickly within a matter of 6 hours or so. And this may happen this week. So that will make it much, much easier for us to clear individuals on our backlog, right? With respect to those people that we might be suspecting might have coronavirus. So all these things combined should be able to assist us. In addition to that, there are people looking at vaccine development. There are also people trying out different drugs, antiviral drugs. And I am very sure that there will be progress along some of these lines. So if we can keep it at bay, if we can keep the virus at bay, maybe some of these other developments will have occurred if the outbreaks around the world haven't disappeared, right? And we should be able to keep our community safe.
Yes, I think nowadays big reporters are running around on coronavirus story every day. So that makes us very busy. The York Region Public Health consider Ontario Ministry of Health or other public health department doing the news update together, so that save us the time and effort, and also we can get the information collectively.
Thank you for your question. So generally speaking, we try and coordinate things where possible. So whenever there's a new case, you have seen the Chief Medical Officer of Health at the Ministry, the Public Health Ontario, as well as the local Medical Officer of Health, being at a press conference together. Today's session is really billed as an educational session, right? For us to be able to get the message out there. And the key messages that we really want to get out, I think they need reinforcing over and over and over again. And the key messages are those guidelines that I pointed out with regard to how you can break the chain of transmission, as well as if you happen to be a host for any of the guests coming from China, make sure that they're following the guidelines that we have actually, pushed out, right? If we did those things, then we would actually be keeping our community quite safe in as much as we can, right? Thank you. Well, if there are any further questions, we'll be happy to assist you. And likewise, I'd just like to invite Patrick to just inform you about some further arrangements that we have made. But otherwise, thank you very much to the media for all your help. We need you as our partners, and I really value your presence here today. Thank you.
Thank you, Dr. Koji. So we certainly echo those comments. Appreciate your assistance. For more information, please visit our website, york.ca/coronavirus. We have frequently asked questions. We have videos on infection prevention, and they are translated into multiple languages as well. And the frequently asked questions are updated regularly as we learn more information about this virus. So thanks again to Mayor Barrow and Dr. Koji. and we are available for one-on-one interviews afterwards as well, along with our translators. Thank you.